We, the International Council of Nurses, are here to present our topic about HIV to United Nations. The General Assembly, Article 5 and 6 states, "No one shall be subjected to torture or cruel, inhuman, or degrading treatment or punishment, and everyone has the right to recognition everywhere as a person before the law." As we all know, today we can prevent the transmission of HIV, and with the treatment, there's a manageable condition. We are very far away from the days when the only practical response to degrade and dread diseases was to have banished the afflicted. You know better than anyone that HIV can bring out the best and the worst in humanity. And the laws reflect these attitudes. I'm not talking about just the laws on the books, but the laws that are being enforced in the streets and the ones that are decided in courts. And I'm not just talking about the laws as they are related to people living with HIV, but people who are at greatest risk of infection. People such as those who inject drugs, or sex workers, men who have sex with men, or transgendered people, migrants, or even people in prison. And in many parts of the world, that includes women and children who are especially vulnerable. So we're here to talk about the relevance of HIV within the global context of health and nursing and its implication on global health. We're going to look at the ways that legal environments are affecting people living with HIV and those at greatest risk, and to recommend what should be done to make the law an ally, not an enemy, of the global response to HIV.
Disease as it affects millions of people in the world, mainly in sub-Saharan Africa. The disproportionate spread of the disease correlates to how the disease is directly related to poverty, socioeconomic circumstances, and ultimately the social determinants of health, as 2/3 of cases are in sub-Saharan Africa, which holds 10% of the world's population. Individuals who are facing economic, legal, social, cultural disadvantages are at an increased risk for becoming infected with HIV. With poor health, it becomes increasingly difficult to retain employment and prevent oneself and one's family from becoming pushed into the cycle of absolute poverty. Related to globalization are forces such as neoliberalism in trade, and these policies have resulted in increased health disparities across countries, according to Duvogli 2011. This has led to poor health outcomes and increased mortality rates, particularly in Africa. With increased trade volumes and travel and relationships between countries, the spread of infectious disease has been increased across countries. Trade agreement conditions often push for privatization of services of the country and lead countries requiring loans from world banks. These conditions lead to decreased public spending revenue, which directly negatively affects the quality of healthcare and education of a country. Finally, trade liberalization has resulted in severe environmental degradation. In order to produce goods faster and remove trade barriers, environmental policies are disregarded. Sustainable or ethical production in trade is not seen as a priority by multinational corporations. As a result, this decreases a nation's access to clean drinking water, clean air, and healthy food.
Implications for global health. Right. HIV continues to remain the leading cause of death worldwide. The first cases were reported in 1981. Approximately 76 million people have been infected since then. In 2010, around 30.7 million people were infected. In 2019, despite significant declines in infection rates, around 5,000 individuals were infected every day, amounting to approximately 1.7 million in total. Today, around 38 million individuals currently live with HIV, and approximately 1.7 million infected individuals are children under the age of 15. Areas that are most affected include Africa, where more than 2/3 of these HIV-positive individuals live in the sub-Saharan African region, as previously mentioned, followed by Asia and the Pacific, as well as the Caribbean, East Europe, and Central Asia being heavily impacted. Right, development, progression of treatment and prevention. Although infection rates have decreased, the number of individuals living with HIV continue to rise due to increased access to antiretroviral treatment, which slows down the progression of the disease by reducing the virus's replication rate, elongating lifespan, and also the reduction of transmission to others. And the development of increased accessibility to pre-exposure prophylaxis and post-exposure prophylaxis decreases infection rates through prevention as well. Other means of treatment and prevention continue to be developed and researched in addition to the current ones, gaining greater momentum and awareness. Right. In regards to COVID-19, individuals living with HIV are prone to more severe outcomes and higher comorbidities from COVID. Due to lockdowns and restrictions, access to diagnosis, treatment, and care have declined rapidly, as there have been disruptions of essential health services and preventative programs.
HIV continues to be a major public health concern as it affects individuals globally and their health equity and inequity. If we look at North America, you'll find that HIV disproportionately infects racial and ethnic minorities, including Black, Hispanic, and Two-Spirit LGBTQ+ members. These populations continue to be vulnerable because of the disparities that cause these health inequities. And all of these inequities are related to the social determinants of health. For example, poverty and low income status affects your ability to access these healthcare services. A low level of education and personal health practice may mean that you do not have the understanding or the knowledge of preventative measures to decrease your risk of contracting HIV, including use of condoms, healthy child development, and gender endowment. So a positive HIV mother passing on the disease to her baby, and that baby growing up with HIV, genders, including men who have sex with men, social environment and culture, including negative stigmas that prevent positive HIV individuals from disclosing their status and not seeking treatment, or just not knowing their status because they are too afraid of the feedback they would get if they went to go get tested. And the physical environment, if there's no resources or services available near them, then it makes it harder to access these resources. If we look at Africa and the Middle East, we'll see that North-South model occurring, which contributes to HIV health inequities. The North-South model is basically the relationship between the rich and industrialized countries on one hand and the poor, less industrialized countries on the other hand. It's been shown that there's an uneven distribution of scientific research. Most research that's been completed on HIV has been dominated by Western and European countries, and they focus on a small number of countries in Africa with high rates of infection. And it makes us wonder about the countries in Africa that continue to have high rates of infection, but with little scientific studies. So this model focuses on the global north transferring their research skills to empower these areas to conduct and lead their own research. However, leadership styles vary globally. And because many African governments rely on these collaborations with Western and European countries, it limits their ability to invest and conduct their own research. Other barriers to developing these leadership roles include inadequate financing, no infrastructures, no established institutional network, inability to create research groups, lack of access to technical support, research priorities, different research skills, and language and cultural barriers.
Six policies and procedures that we believe should be implemented in order to respond to the health implications previously mentioned include education, peer support framework, and STI prevention, testing and counseling, surveillance, and funding. An education framework aims to help those who need assistance with literacy. Most educational resources provided typically encompass large and complex health-related terms. By putting in an education policy that states that educational literature must stay within the grade 3 literacy level and include numerous amounts of illustrations, it allows people living with HIV, as well as people trying to prevent HIV, to ensure that those people can obtain the information they need in order to make the right healthy choice for them. A peer support network allows for people living with HIV and AIDS to have intergenerational support, community clinics, men clinics, and women clinics to help those feel help those with HIV feel less discriminated against due to their health conditions. It'll also help with decreasing the stress and anxiety that comes with the stigma of the diseases. And STI prevention policy would include routine testing in these health clinics to ensure early detection of HIV and AIDS. These testings also could allow healthcare professionals to use the information to help develop care plans based on the most affected populations in their communities.
So as mentioned, the aim of public policies is to reach key populations and link them to testing, prevention, treatment, and care. As a result, HIV policies, national or international, must also introduce effective responses through increased HIV funding, budgeting, and increased surveillance reports. HIV testing and counseling policies are very significant methods to strengthen the prevention of HIV efforts and encourage the diagnosed or newly diagnosed population to avoid transmission to others. It can also motivate not affected populations to adhere to risk reduction strategies. Furthermore, regular surveillance reports include the rates of HIV diagnosis, the number of people with HIV, and the number of people who are receiving HIV medical care. These findings will help in analyzing, interpreting, and disseminating data. Such process will boost government's understanding of the capacities and barriers in HIV prevention and care, along with ensuring the understanding of the emerging trends. Our last policy, we believe, could target the HIV dilemma is government's HIV funding and budget policies. It is essential for all governments to be transparent and open on their budget spending towards such significant issues. Governments must provide meaningful access to information so that all citizens can have an overview of federal budget allocation for domestic HIV programs and research. In addition, a portion of government's budget must go towards harm reduction fundings. They are support programs that will help reduce HIV among people who share injection drug use equipment. So such policies and implementations will boost all governments' abilities to target vulnerable population, increase prevention and spread of HIV. Although they may seem rather easy methods, a dedicated teamwork and union is required globally.
There are many ways nurses can promote global health. Nurses can promote and push for HIV self-testing. By increasing self-testing, we are promoting patient autonomy and giving patients respect to take the test somewhere confidential. And by doing that, we reduce stigma and discrimination associated with testing at HIV facilities because they can take the test wherever they like and nobody will know. Having self-testing also reduces additional barriers such as excessive travel costs, missed work, and accessible testing for the hard-to-reach populations. This would also increase the number of people who actually take the test because they would not have to choose between losing money and taking care of their health. Nurses can also engage patients to support groups. This allows patients to share experiences, improve self-esteem, and enhance patient coping skills. This reduces stigma, discrimination, and the idea of what will people think because patients will meet other patients with similar circumstances. A study was also conducted to see if support groups reduce the frequency of HIV-related symptoms. The study reveals that support groups associated with the reduced frequency of HIV-related symptoms, such as anxiety, insomnia, and depression.
As nurses, we are taught to consider the entire clinical picture to help develop a plan of care. Nurses can address the needs of the population by applying the social determinants of health and determining which resources need further development to strengthen the community. Nurses can advocate for community initiatives for safe gardens, nutritious food, and more accessible clean water to help support the clinical outcomes of individuals with HIV. As we saw in Van Tyler and Shields, lack of access to clean drinking water and malnutrition can contribute to adherence to pharmacological therapy. As a part of community initiatives to supply resources, nurses can also facilitate education programs about healthy behaviors and actions to support the trajectory of the overall of overall wellness. In an article by Un et al., they identified that there are individuals who have not received education on the basic nutrition concepts to aid the disease process. They have also identified that education was a key contributor to adherence of nutrition programs and pharmacological interventions. The best way to achieve the community initiative is by providing the government with a participatory community action plan that outlines the goals of the initiatives and the desired outcomes.
We, the International Council of Nurses, accepted the prestigious International AIDS Society Presidential Award on behalf of all the world's nurses. Our mission is to present nursing worldwide, advance the nursing profession, promote and advocate for health in all policies. Nurses have always played an important role in the HIV response, and in 2020, they have stepped up even more to meet the needs of the COVID pandemic. ICN is proud to be associated with and as the fight to combat infectious diseases continues. And this award will give a boost to millions of nurses worldwide who are again engaged in a fight against dangerous and highly contagious viruses. It is our vision that the global community recognizes, supports, and invests in nurses and nursing to lead and deliver health for all, starting those struggling with HIV. Thank you.